But without further ado, I would like to introduce Rudzani to you. Rudzani is much more than a doctor. He is a philosopher, in my terms. I've heard some amazing pearls of wisdom from Rudzani, and we've got a little time for him this evening before we move on to the discussion with Tony. So Rudzani, all yours for 10 minutes.
Thank you very much, David, and thank you for that introduction. As you rightly pointed out, I don't have a lot of time given what you want me to share right now. I'm not sure if you can see my slides, David. Is that looking clear?
Yes, all clear. All clear.
Okay, thank you. So I just thought I'll share a few things, and I think there are two things here. I was asked to kind of just reflect briefly on the first 1,000 days, as well as just to kind of give some kind of update as to where we are as a country as far as vaccination against COVID is concerned. Some of you who watch cricket would remember a guy that came to the scene around 2000, a guy from the Eastern Cape called Mfuneko Ngam. Mfuneko was regarded as a really amazing prospect and phenomenon when he came into cricket that year. He unfortunately only managed to play 3 tests for South Africa. He took about, I think, I can't remember how many wickets he took altogether in those 3 tests, but he took them at an average of less than 18 for those who watch cricket. He was actually regarded as having the very same bowling style and prospect of being as great as some of those old West Indian bowlers of the late 70s and early 80s, you know, with that amazing flick of the wrist that just gave him an extra, 15 Ks per hour or so at the end of his bowling spell. So, but the reason why he played so few tests is that Mfuneko had suffered an injury and that he never recovered from. He came back to try ball again, and then he had more fractures. And what became clear was that there was something wrong with his bones. A number of tests were done, but what eventually this seemed to be the case is that Mfuneko, in fact, may have had an early childhood deficiencies in terms of nutrition that made sure that his bones never mineralized at all. So there he was, an adult with great potential for being one of the great of the games. But what happened in that early phase of his life, in fact, had a whole knock-on effect in the rest of his life and the rest of his career, which really never took off again at national level. And this is why it's so critical for us when we thinking about the early developmental stages of a child, of how we think about this and contextualize this. And I say this again when I'm talking about Ngam with a bit of caution, because I'm always worried of us not seeing children as raw materials for creating productive adults, but of actually understanding that the whole point of childhood is being a child, and we need to focus on that. But the reality is that children do grow, and unless they can survive and thrive, then they can never be meaningful contributing adults in a society, which is the idea of transformation, where you have not only thrived, but you are able to make meaningful contribution into that. That is why for the last decade or so, a number of entities, including United Nations, WHO, UNAIDS, have actually adopted this idea of thrive, survive, thrive, and transform. And a lot of that has a lot of finding a life course that is meaningful and sustainable in order to allow people to grow and to reach their full potential. And for us in pediatrics, and that starts as early as a child is born. In fact, before, as I will show right now, the child gauge, which is done by the Children's Institute every year in 2017, used as the theme of their publication for that year. And what was important was to understand this idea of how far back we should start if we need to allow children to survive, thrive, and transform throughout their whole life course, but starting as early as possible. And this is important because thinking about in this kind of terms of survive, thrive, and transform, because it overlaps a number of areas that overlaps with number of sustainable development goals that we are now looking at and working towards, that overlap a number of areas within children's development. And as a pediatrician, most people will think about most of our work happening between these two dotted lines, which is from birth the whole way to adolescence. But I think what is true and what is real important is to understand that these 1,000 days that occur around this area actually start before a child is born and then continue after a child is born. A mother who is undernourished has got a huge impact in what kind of baby comes out at the end of the pregnancy. A mother who is on drinking alcohol or is on some kind of drugs, which happens in poor communities, is going to impact negatively on her baby. So the 1,000 days, if you think about them as starting at birth, it's a problem because within that context, it misses a lot of what needs to be done even before the baby is born. So what is so important for us is to understand within this whole bigger concept. That's why survive, thrive, and transform is firmly anchored in the primary health care approach, which basically is sectorial, it's collaborative. It looks into all these kind of areas, survival, don't die, thrive, ensure well-being and health as you grow, but the transformation in the end, which continues throughout the whole of childhood into adulthood, is someone being enabled to actually be a member of community, contributing and fulfilling their true potential. So again, that's why, for example, I had this kind of attraction to one-to-one, given what they do, which is a work that happens within communities, because what it does, it allows that primary health care principle to exist with real meaningful community participation, where communities are allowed to make a meaningful contribution to the well-being of that community. And you can't look after that child without looking after its mother, and specifically without looking after the community in which those two are actually anchored. And that's why programs that are cross-cutting and intersectorial are likely to actually make a meaningful impact in a child's 1,000 years that in 10 will be able to have a huge impact in the rest of their lives. David, I'm showing this picture again because you mentioned it now, that for me, this idea, I've been speaking about the idea of building cathedrals for the last number of years. And for me, it is this huge investment that we need to make into things that we may not be able to see, or that we cannot see now, that will actually only develop in the future. St. Paul's that I've given here is probably a very bad example of how most cathedrals go, because it was built and completed in just over 30 years, depending on when you start counting from. But the Christian Wren design, which is what you see of St. Paul's, not the previous designs, took quite a long time from its design to its building. But that is exactly what happens. When you build a cathedral, you basically invest into a future that you may not even be able to see, or whose future is unseen from where you start right now. And that's unfortunately what happens with the first 1,000 years, and even the pregnancy of the mother who will give birth to a child that you then need to intervene. But that is exactly the courage that we need and the outlook that we need to have when we want to build for something that is sustainable and that can have a meaningful impact into the whole of society. And just overlapping with the next part that I was talking about, again, looking at this child here, that was shown on time a few years ago, is that if you look at the history of humankind, most of our life expectancy have been quite low, actually below 30 years of age. But the last 200 years have seen quite a big jump. And a lot of that has had to do with what investment we've made especially and most especially in childhood. A lot of these are probably these gains are probably the result of immunization and vaccination. In fact, vaccination has got the greatest impact in poor communities and those who are marginalized, because very small investments have got huge returns in terms of what you reap from that. And that is why for us it's been quite a major concern when it came to COVID vaccines. And now I'm going to give the South African kind of setting, and as I finish my 10 minutes. If you look at how COVID vaccines have been distributed in this pandemic, most of those doses that are available have been concentrated mainly in the rich countries. And that's because of the so-called advanced market purchase, where most of these countries managed to buy most of those vaccines before they were even produced. I mean, other countries such as Canada probably bought more than, close to 10 doses per each Canadian. Of course, they were hedging their bets, but the result of that is that the poor countries could not get access to these vaccines until these countries that have got money have already vaccinated all their citizens. And that impact, apart from being seen in the adults that have been dying, will have dire consequences in poor countries, especially in their children that will then grow either with no parents or grandparents that were parents having died through the pandemic. And we're seeing a lot of these happening in India right now. For the vaccines that were in the lead, most of those that you can see, Pfizer, Moderna, AstraZeneca, and even the Sputnik that were kind of the front runners, most of them were snapped by the time the poor countries could actually manage to invest in them. And the same thing happened with South Africa, that by the time that we could try to purchase vaccines, although we got AstraZeneca, by that time the new variant that we now know of had already come up, which meant that the AstraZeneca vaccine couldn't be used. And then what then happened is that South Africa then had to take this route of taking the Janssen vaccine, the so-called Johnson & Johnson from the Johnson & Johnson company, that then became the backbone for their phase of vaccination. You probably know now that we had number of, we've had the first phase, which is a vaccination of healthcare workers. It had to be divided now into phase 1A and phase 1B. Phase 1A was where the Johnson vaccine was being used to try to cover healthcare workers. That was being done as a 3B trial. And the reason why that was the case is that the vaccine had not yet been formally authorized. And about 500,000 doses were made available to vaccinate healthcare workers, estimated at about 1.2 million. We managed to vaccinate about 480,000 healthcare workers with that when the trial ended about a week or so ago. And the phase 3B is now being mopped with the Pfizer vaccine that has now become available. There are a number of doses that have been that have come into the country, and that is basically where we are right now. So right now this week, a number of elderly people and those who are high risk who belong to phase 2 are now being vaccinated, as well as completing the phase 1 a mop-up of healthcare workers who did not receive the limited Johnson & Johnson doses during the trial phase. And then if we manage to get more doses, and there's hope that they will trickle as the year progresses, that now phase 3, which will be the balance of the population of vaccinating at least up to 40 million people, may then be carried out. And that's basically where South Africa finds itself, but it finds itself in the context of not so much a lack of willingness to vaccinate, but in a world in which the vaccine doses are not readily available. And again, as I worry about the country here, as well as other poor countries, I worry a lot about what the impact is going to be on indirectly on children that don't seem to be getting COVID of the severe sort that you see in adults, but that the indirect impacts on their mothers and other family members will have long-lasting impact. I think I'll stop here. I'm sure that this was skimming over two very deep and which should otherwise be detailed topics. Thank you very much for that, Deb.
Okay. Rudzani, thank you. That was quite an overview, and we'll have your slides and the and your presentation in replay when because this is being recorded right now, especially for a number of people that weren't able to be here this evening.